Healthcast. While colon cancer rates are dropping in older Americans, there's been an increase in younger generations.
And that has a panel of health experts calling on colonoscopy screening to begin earlier than the age of 50. Local 10 medical specialist Christy Kruger has details.
Alexis Graham was in her early 30s when she was diagnosed with colon cancer, but today she considers herself lucky.
I am 4 years cancer-free, and I have to come in for a checkup twice a year. After my 5-year point, I only need to come in once a year.
Patients like Alexis are raising concerns. While screening guidelines for colonoscopy are currently set at the age of 50, the U.S. Preventative Services Task Force wants to move that up to the age of 45. Dr. Stephen Wexner, a colorectal surgeon with the Cleveland Clinic Weston, thinks screening should begin even earlier.
And the reason is the number of patients we see who are younger patients without a family history, without any predisposing factors, who suddenly come up with colon cancer.
Along with earlier screening, Wexner says it's important to look at possible causes for these younger patients.
Yeah, it's multifactorial. The age is decreasing in part because of a genetic drift, and you know, as the gene pool changes over years and decades, there seems to be more of a predisposition, and some of that is environmental, and some of it is dietary too.
The doctor says the tragedy is that because colon cancer is typically not suspected in younger patients, they're often not diagnosed until the disease has really advanced.
It typically presents with bleeding, and it's ascribed to hemorrhoids, or they present with some abdominal symptoms and they're told it's irritable bowel syndrome.
That's what happened to Alexis, and what motivates her now to urge others not to brush off any unusual changes.
I feel like if you have symptoms, go and get a colonoscopy done so you can know what's wrong and start working on it.
Now, excluding skin cancer, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. With your HealthCast today, I'm Christy Kruger.